where we at the Division of Health, Wellness and Family Development update you on all things as it relates to health and social services in Tobago. My name is Rian George. I am the Senior Corporate Communications Officer at the Division of Health, Wellness and Family Development. It is indeed my pleasure to take you through yet another media briefing. This afternoon we have 4 panelists with us. Leading the panel would be Councillor Nadine Stewart-Phillips, the Assistant Secretary in the Division of Health, Wellness and Family Development. We also have with us Dr. Tiffany Hoyt, the Acting County Medical Officer of Health. We have with us on the table as well Dr. Roxanne Mitchell, the General Manager of Primary Care Services, and we also have virtually Dr. Victor Wheeler, the Acting Medical Chief of Staff. So I invite at this time Councillor Nadine Stewart-Phillips, who would give her presentation.
Thank you very much, Mr. George. A pleasant afternoon, members of the media, our viewing and listening audience on Facebook Live and TTT. Welcome to the Division of Health, Wellness and Family Development's weekly press conference. I will be providing an update on our continued psychosocial response from the Family Development Department related both to COVID-19 and instances outside of COVID-19. I start off this afternoon very reluctantly by highlighting that over the last few weeks, and we can possibly say months, we have been experiencing instances of gender-based violence in Trinidad and Tobago that have been quite disturbing and quite traumatic. Gender-based violence is, first of all, a human rights issue, and it requires the engagement of everyone. So it requires the engagement of men, of women, of boys, and girls. And it was Martin Luther King who once said, "Injustice anywhere is a threat to justice anyway." We are caught in an inescapable network of mutuality, tied in a single garment of destiny. And whatever affects one affects all indirectly. And I am sure that we can all admit that collectively we have been impacted in one way or the other over the last few weeks, given the many instances of gender-based violence in the country. At the Division of Health, Wellness and Family Development, our gender unit and the Family Development Department continues to provide the support needed to any person that may be faced with these instances. So our Blue Room continues to provide a holistic space for men's health. Men, you have a designated space to access physical health checks as well as receive referrals for psychosocial support whenever it is needed, and so that is specifically for our men. We have our Women Empowerment Technological and Empowerment Center, and that's where we provide temporary support to women and families who may be in need of such support. Our social workers continue to be of assistance to women, men and families with food support, as well as action planning for transitioning into their abuse-free life or into an abuse-free life. In the area of advocacy, we collaborate with various international organizations to advocate for and behalf of the vulnerable in our society. The gender unit helps to amplify the voices of the marginalized in our society through social and, of course, our traditional media. So we are reminding everyone, men, women, families, that you can access the division's services that continues to be available. And as the Christmas season continues, I want to encourage all of our residents to be prudent, to remain vigilant and aware of your surroundings, and this is to avoid being an easy target. If you find yourself shopping late at night, try to park close to a lamppost as possible, close as possible, and be aware of your surroundings. Look under, in between, around your vehicle and immediately lock your doors once you are on the inside. Always have your cell phone so you are ready to place a call to the police or to anyone in case of an emergency. If you are staying at a hotel or a guest house, a villa, try not to ever open your doors if you did not invite someone into your room. If an unsolicited staff member knocks on your door, please contact the front desk and make a report. And so these are just a few tips that can be utilized as we continue throughout the busy season. We are also asking persons as much as possible in emergency situations to contact 211. This is a toll-free number, and they would then route you directly to one of our gender support officers or our social workers at the Division of Health, Wellness, and Family Development. I move now to provide an update on our response effort towards meeting the social and psychological needs of our residents as it pertains to COVID-19. The Ministry of Social Development and Family Services provided both food and income support to applicants from Tobago. And I just want to take this opportunity to really extend a heartfelt thank you to the Minister Donna Cox, her permanent secretaries, and all the staff at the Ministry of Social Development and Family Services who continues to go beyond the call to ensure that applicants from Tobago, that their grants are being processed and payments are being made in a very timely manner. Based on information that we have received, there were 1,885 applicants for income support and 1,891 applicants for food support, all of which have been paid to date by the Ministry of Social Development. And this is in addition to the over 1,000 food vouchers that we have been distributing from the Division of Health, Wellness, and Family Development, and also in addition to the food cards that have been distributed from the Division of Finance and the Economy. As it relates to rental assistance, from our records, there are currently 1,023 applications for rental assistance. Of this, 814 applicants met the qualification criteria, and landlords were paid up to 3 months at a sum of approximately $7.5 million. There are still close to 100 applications that are incomplete, and I am sure every time I have spoken to the media, I would always say we have a number of applications that are incomplete, and despite our efforts to assist the applicants in completion of these forms, some of the applicants either have not answered our calls or refused to answer our calls or could not produce the necessary documentation to support their application. We have also extended the rental assistance in Tobago for a further 3 months, specifically to persons who have not yet returned to work due to the continued restrictions of the COVID-19. For example, employees in the tourism sector, and thus far we have received about 60 of such applications, and we would be processing those in the coming weeks. So as a division, we continue in our efforts to meet the needs of our vulnerable population, providing the necessary support and resources to persons on a daily basis. 2020 has been a challenging year for all of us, but as we prepare to usher in the Yuletide season, I really want to take this opportunity to encourage all of you to be prudent and to be aware of your surroundings to avoid being an easy target. At the Division of Health, Wellness, and Family Development, we continue to ask of you to adhere to the guidelines and guidance provided by our health and medical officials. We cannot stress this enough, and you wouldn't hear enough of that from us. We know that it has been a long couple of months, basically not being able to socialize or to interact as we are accustomed to, but we are asking again that you continue to exercise good conscience. Remember, you may generally be in good health and not exhibiting any symptoms or showing any signs of COVID-19, but we are asking that you be mindful and give thought to those who may be immunocompromised, those who may have pre-existing conditions, those who may have comorbidities, some who may be in your home and not able to fight off this virus. Just by way of a quick public announcement, the Division of Health, Wellness and Family Development, in collaboration with the Division of Infrastructure, Quarries and the Environment, and the Division of Community Development, Enterprise Development and Labor, will be engaged in an island-wide cleanup campaign starting Wednesday, 16th December, and completing on Wednesday, 23rd December, 2020, during the hours of 6 a.m. to 6 p.m. This exercise will entail the collection of derelict material, including old stoves, refrigerators, microwaves, and household appliances such as washing machines, old beds, mattresses, etc. However, it should be noted that materials such as construction waste and agricultural waste would not be collected as part of this campaign. And so starting on December 16th, the caravan would be in Crown Point, Bonaccord, Canaan, Buku, Mount Pleasant, Canby, and Bethel, Mount Irvin. On December 17th, Lambeau Signal Hill, Scarborough Calder Hall, and Bacolet, Mount St. George. On December 18th, Plymouth Golden Lane, Blackrock, Wim Spring Garden, Providence, Mason Hall, Moriah. On December 21st, Castara, Lansford, Speyside, Roxborough, Delaford, Bell Garden, Goodwood. And December 22nd to 23rd, those would be reserved days. So we are asking that you please take note of the days that the cleanup campaign would be in your community. We have divided them into electoral districts. And of course, you can follow our social media for an update on the day-to-day cleanup campaign initiatives. And so, as I close, I take this opportunity to extend season's greetings to all of you, and I trust that our resilience as a people will transcend into a bright and prosperous 2021. I thank you.
Thank you very much, Councillor Nadine Stewart Phillips. Quite a bit that you has presented. At this time, I will invite Dr. Tiffany Hoyt, who would give us an update re-COVID-19. Dr. Hoyt.
Thank you, Mr. George. Pleasant good afternoon to everyone. So the update on the statistics for Tobago as of 10 p.m. yesterday, the 14th of December. We had no new cases recorded yesterday, but we had 5 discharges. So currently, we have a total of 17 active cases on the island. Since the outbreak began in March, we've had a total of 139 confirmed cases out of 2,103 samples, which would have been submitted for testing. I just want to give a further breakdown with respect to the cases we currently have. So there was a period in time when we had no cases recorded, and then as of the 25th of November, we saw a resurgence of cases. From the 25th of November till now, we've had a total of 32 confirmed cases recorded for that period. Out of these 32 cases, 11 of these have been children under the age of 18 years old. So I just want to use the opportunity to make the point for persons to be very cognizant that you need to practice the public health guidelines. You need to make sure and wear your mask properly over your nose and your mouth. Make sure you ensure that you're practicing physical distancing. washing your hands frequently, and please, please, please avoid gatherings so that you don't take home COVID-19 to the young ones and to the elderly. Please, because the other, what we've also had through our contact tracing, what we've found is that we've had 8 clusters. That's persons who would have become infected because of contact with one another. And our largest clusters, our 3 largest clusters, arose because of family social gatherings. So this was not due to friends gathering, it was strictly family members that had social gatherings, and as a result of that, we've had our 3 largest clusters. So the appeal has been made to members of the public to please avoid gatherings this Christmas. Yes, we know Christmas is a time for family, but please avoid gathering even among your family because it really is a threat to have gatherings. So I just want to remind persons of that, and that's my update, Mr. George.
All right, thank you very much, Dr. Hoyt. We move over to Dr. Tiffany Hoyt, Dr. Roxanne Mitchell, who would give us an update on primary care services. Dr. Mitchell.
Good afternoon, ladies and gentlemen. Thank you, Mr. George. Today, I would like to speak to the public with regard to masks. With the onset of COVID-19, one of the public health guidances would have been the wearing of face coverings, specifically masks. Now, this is a new piece of clothing, if you want to term it that. And with it should come specific guidelines that we may have assumed along the way that persons would adhere to, but I would like to just outline a number of the guidances in terms of mask wearing going forward. You should wear a mask or face covering in any public space where physical distancing is going to be a challenge. If it's not possible to physical distance, you must wear a face covering or a mask. If the face covering cannot be worn because of health problems, because of medical issues, you do have the option of wearing a face shield. All right, there are a number of persons who will tell you they're asthmatics or they have sinus issues. You can wear a face shield, which would also protect you, but it does not prevent you from physical distancing. You must stay about 6 feet apart from other individuals. When should face masks be worn? Public transportation, within stores, even when you're on the pavements, when you're there in your neighborhoods on the block, you need to wear your mask and to wear your mask properly. Wearing your mask properly entails covering your mouth and your nose, not just the mouth. It has become fashionable for many to just simply pull the mask below the nose. You are to cover both your mouth and your nose going forward. I was recently asked a question with regard to what would be some of the long-term effects of wearing a mask and if it will contribute to a deterioration of health going forward. There are a number of things that you can do in terms of reducing risks. And one of the things should be changing your masks on a daily basis, washing your mask with soap and water prior to using or reusing a mask. There are a number of persons who simply put the mask on the dashboard or out in the sun just for sunning. There are persons I've heard using alcohol to just spray them and reuse them. The same advice we have been giving persons with regard to washing your hands using a detergent and water must be applied to cleaning and sanitizing a mask. Once you're wearing a cloth mask, once you are using a face shield, you need to use detergent and water. And again, it must be in the soap or the detergent for more than 20 seconds to kill the virus. You rinse them properly, and of course, you dry them by whatever method you choose. Keep in mind, please, that the mask is going against your face. Some persons have argued that they're getting acne and the little bumps along the face with the masks. Please use either the normal laundry detergent or your fabric softener, if that is what you're accustomed using to wash your clothes, or you could use your bath soap to wash. There are persons who are using detergents for washing wares and stuff like that to clean the mask. These are a bit harsh, and you need to be very careful. You treat the mask like you will treat your underclothing. Wash them before you reuse them. Try not to use a mask for more than 8 hours. If it is you're in an environment where you're going to be sweaty, unfortunately, I'm asking that you probably may have to use 2 masks a day. All right? Ensure that you protect yourself. With regard to masks themselves, we have a number of masks out there. You have the 2-layer or 2-ply thick cloth mask. You have the 3-layer or the 3-ply cloth mask. You also have the cloth masks with valves. Those with valves would allow you to engage in physical activity and not have the issue of breathing in, the difficulty breathing that a number of persons have been experiencing. For persons who have, again, sinus problems, asthma, allergies, you also have the masks that will contain carbon filters, which will allow you to filter the air coming into your lungs. All right? And because they also have the valve, they would allow you to exhale and to breathe out the air within your lungs as well. So it makes it a lot easier for you to breathe. So you do have options going forward. For persons who are using surgical masks, we have noted that some persons just use and reuse. These are disposable items. They should not be worn for more than a certain number of hours. And I'm not saying an hour today, an hour tomorrow, an hour the day after. All right? Try not to reuse these disposable masks. I am aware that persons are washing them, if only because of the cost of them and you're trying to get more life out of them. But my advice to you would be to at least try and get 1 or 2 cloth masks to alternate with the surgical masks going forward. All right? And I think that will be my update for you with regard to mask wearing today. Thank you.
All right, thank you very much, Dr. Mitchell. And one more presentation virtually, we will go to Dr. Victor Wheeler, the Medical Chief of Staff at the Scarborough General Hospital, for his presentation. Dr. Wheeler.
Good afternoon. Thank you all. Thanks, Rian. Welcome, everyone. I'd just like to briefly repeat an appeal that I made in November for blood. We had a very successful response to the blood drive that we engaged in November. However, coming up to Christmas, just over a week again, the hospital stocks have started to run a bit low again. So I'm just appealing to persons, those of you who can, to come and give blood. The blood bank hours are 8 a.m. to 4 p.m. and on Saturday, Monday to Friday, and on Saturdays, 8 a.m. to 12 noon. Thank you.
All right, thank you very much, Dr. Wheeler. So at this time, we'll open the floor to questions from members of the media. And we just ask that you raise your virtual hand so that we have some order. And you have 3 questions per round. So the floor is now open for questions from the media. Elizabeth Williams, you could go ahead. Good afternoon.
Hi, good afternoon, everyone.
Good afternoon, Liz.
Good afternoon.
Hi. What I wanted to know, especially from a comment from Dr. Hoyt, is in light of these COVID or /ZESA parties going on in Tobago, as far as you are aware, what I wanted to say is that over 100 young persons attended that ZESA party in Tobago that was busted by the police. Is it that these young people were tested for COVID, or they were just allowed to return to their homes?
That's it, Liz. No other questions?
That's it for now.
All right. Thank you, Dr. Hoyt.
Hi. So the persons who would have been arrested at the party, they would have been subject to the law, but part of that does not include testing for COVID-19. That's not part of the routine protocol. Persons who are tested for COVID-19 would be those who we know to be contacts of a confirmed case, or persons who present to a health facility or call the hotline and identify themselves as having viral symptoms. Those are the persons who are routinely tested for COVID-19.
All right, thank you very much, Dr. Hoyt. Olive Gonzalez. Olive, you could go ahead. Olive, you could go ahead. We're hearing, if you're hearing us.
Yeah, hello, good afternoon. Are you hearing me now?
Yeah, Olive, we hear you. Go ahead.
Good afternoon. I
Good afternoon.
have two questions for the Assistant Secretary. My first question is on the issue of gender-based violence. Can the division provide us with any data on this type of violence for the Tobago division? And my second question for the Secretary, concerning grant application, rental grant application, that is. I'm not sure if I missed it, but did you say how many grant applications were rejected and why these were rejected? Thank you.
All right, thank you very much, Olive. Sec?
What's the first question?
First question, any data on gender-based violence for Tobago?
So the data would be available at several different units. We would have some at the Division of Health, Wellness and Family Development. We would also have at the gender-based unit of the police service. But once the division requires data, we would get it from the police department. So the data is available. We also have to be mindful and cognizant that we only get the data once the information is reported. Yeah, so as long as the information is reported, then we would have the data available.
All right, and the second question, I know you would have shared this before. How many rental grants were rejected and why?
I don't have that specific number today, but if I remember, it could have been probably around 90 applications. And it were for a number of reasons. A number of persons applied for rental assistance or some sort of grant as outlined by the government, and they were still employed. Some persons had a government job as well and may have lost income from some other job, probably a business, and they wanted to apply for the grant, and so they were not able to access the grants. We have persons where their households were earning more than the stipulated amount, which is over $10,000, and so on that basis they were denied as well. We had applications for rental assistance for commercial spaces, which was not outlined in the agreement or in the stipulations, and so once you submitted an application for commercial space, then you were denied. So those are some of the reasons. I don't have the specific number with me today on the number of applications that were actually denied.
All right, thank you very much. We have questions from Whitfield Turner from I-95.5 FM via WhatsApp. And the questions to Secretary Stuart Phillips. Why not process all grants in Tobago and have the central government transfer the requisite monies to the THA for greater efficiency? And to Dr. Hoyt, the recent imported cases from Trinidad, did they come primarily via boat or plane? And 3, are all 32 cases epidemiologically linked? So Secretary first, and then we'll go to Dr. Hoyt for the other 2.
All right, thank you very much, Whitfield, for your question. So very early at the onset of the pandemic, the government and the cabinet of Trinidad and Tobago made a decision to have these grants available to citizens of Trinidad and Tobago. We did have some teething problems in terms of where the applications were submitted. However, we forged an amicable relationship with the Ministry of Social Development and Family Services, and they have been working with us very assiduously. I guess going forward with field, it could be something that we can discuss at the level of the Executive Council and also at the level of the Cabinet to decide if the funds would be transferred to Tobago. However, we have not had any recent problems in terms of processing. Once we have the documentation, as a matter of fact, once the applications are sent to us, we do all the background information and send to Trinidad, and Trinidad just make the payments to the applicants.
All right, thank you. And Dr. Hoyt, the recent imported cases from Trinidad, did they come primarily by a boat or plane?
All right, so let me share. Let me share two instances. We had an instance where one of the cases, which is someone who resides in Tobago, one of the confirmed cases, would have, while experiencing symptoms, taken public transport and then would have traveled via the ferry and taken public transport while in Trinidad. We also had a case where someone would have visited from Trinidad and would have taken the plane. So I just want to make the point that anybody who is traveling using public transport, be it the ferry, be it the plane, be it a taxi, once you are using public transport, once you are exposed to other persons, you don't know who has COVID-19 or not. So the precaution is that you have to basically treat everyone as if they have COVID-19 and take the necessary precautions, especially using any form of public transport.
And were the 32 cases epidemiologically linked?
So out of the 32 recently confirmed cases, 8 of them had no epilink. The other cases would have been in clusters. We've had 8 clusters. So 8 of them would have had no known contact to a confirmed case. But again, community spread is ongoing. So.
All right, thank you very much, Dr. Hoyt. Elizabeth Williams, you could go again.
Okay, this question is for Dr. Hoyt again. In terms of the clusters that you spoke about, the 8 clusters, if I remember right, which particular areas in Tobago are you these clusters emanated from?
So,
thank you very much, Liz. Go ahead.
Okay, so I don't want to I don't want to blacklist any particular area, but we would have shown from the distribution of cases throughout Tobago, the majority of cases do reside on the southwest side of the island, and that continues to be the distribution that we have seen.
Thank you very much, Dr. Hoyt. Olive Gonzalez, you could go ahead again.
Good afternoon again.
Good afternoon.
Everyone is hearing me?
Yes, we are. Go ahead.
Okay, I have 2 questions again, if I'm permitted. One for Dr. Hoyt and one for Dr. Wheeler. To Dr. Hoyt, can I get an update on the 20 fire officers that were sent into quarantine over a week ago? And Dr. Wheeler, from the last time you made a public plea for blood donation, have you seen any kind of increase of people coming forward to donate blood? And also, would you say that Tobago's blood bank is critically low or remains critically low? And also, if possible, if you could give me an idea if this situation is affecting patients who may need blood to do surgery. That's my 2 questions. Thank you.
All right, for Olive, but thank you very much. Dr. Hoyt, an update on the fire officer sent into quarantine.
All right, so let me just clear up some facts, because I noticed that there have been some figures and information going around which may not be completely correct. So we had only 1, not 114, only 1 fire officer testing positive from the Crown Point Fire Station. From that 1 officer, the contact tracers would have identified only 20 of the officers at the station as being in close contact with the fire officer, as well as the officer's social contacts. Those 20 close contacts would have been tested. They all tested negative, so none of them had contracted COVID-19 at the time we tested them, and they continue to be observed for the 14-day quarantine period if anybody develops symptoms, they will be retested. The Trinidad and Tobago Fire Service, out of an abundance of precaution, also decided to ask the remaining officers at that station, they gave them a stay-home order. So let me just indicate that persons weren't quarantined by public health. Public health only would have quarantined 20 officers. The other persons were just asked to stay out of an abundance of precaution. We've been working with the fire services to review their protocols and procedures which they had in place, etc. And I just want to use this opportunity to express to employers, be them private employers as well as persons within public service, if at any point in time you believe one of your employees has been in contact with someone who has COVID-19, please, please, please call the Public Health Department. Our office number is 639-3751, or you can contact us through the Division of Health, because it is not just a matter of sending persons home. If the person really was a contact, we need to investigate and determine. If that's the case, persons may need to be tested. All contacts would need to be identified. And persons, if you just send persons home, they are not being monitored by public health. There's a process that involves monitoring persons for the 14 days to see if they develop symptoms. So once again, anybody, any employer, you believe that an employee has been a contact of someone who has COVID-19, contact public health so that the necessary investigations, public tracing, testing, monitoring can occur. Thank you.
Thank you very much, Dr. Hoyt. The questions posed to Dr. Wheeler, I know you would have shared it in your presentation. The question being, would you say that the blood, that you would have seen an increase in persons donating blood since the last request? And would you say that at the Scarborough General Hospital now is the blood level critically low? And would you say if this is affecting patient care for those who need blood?
Okay, thank you. Yes, we did see a very good response to the last appeal for blood. Persons came in and did donate blood, which raised our stock levels to a quite satisfactory one. However, over the past week or two, we've seen a falling off of persons coming to give blood, and as a result, the levels are running low again. Today was the last day for routine elective surgery. So from tomorrow until the new year, we will not be having any routine surgery. All the surgeries that will be done from now until the new year would be emergency surgery. So as a result of that, there's no issue of elective surgeries being affected.
All right. Thank you very much, Dr. Wheeler. I have some questions from Whitfield Turner. To Dr. Wheeler, there are complaints about persons who attend the clinic at the Roxborough Health Center and that no provision is made to accommodate them in the event of inclement weather. Can anything be done to accommodate them in the event of rain? So rather, this would be to Dr. Mitchell. And to Dr. Hoyt, have there been any recent instances of foreign nationals entering the island illegally? And what provisions are in place for such persons who could be COVID positive? So Dr. Mitchell?
I am not aware that persons are not being accommodated within the facilities. We did have at one point the tents that were placed on the outside to accommodate persons who may have presented with flu-like symptoms. Persons are on a blocked appointment system for every clinic that we have, and that includes the Roxborough Health Center. What needs to happen, and because I think we would bring in about 4 to 6 persons per hour, unless persons are gathering outside of the facility for another reason. All right, but as far as I know, we accommodate all persons coming in for clinics, all right, so that they do not need to be on the outside for services. If there is a problem, though, Mr. Turner, can you please contact me directly so that I can address that particular issue?
All right, thank you, Dr. Hoyt. Any recent instances of foreign nationals entering the island illegally, and what is in place for them?
So illegal entry of foreign nationals is a matter of national security. So they would be the one that could actually better provide that information, and they would explain the protocols they have in place to treat with such matters.
All right, thank you. Any other questions before we wrap this media briefing? All right, if not, I would invite the Assistant Secretary to just give her final statements before we wrap this media briefing. Assistant Secretary.
All right, thank you, Rian. I just wish to reiterate a point that Dr. Hoyt made in her contribution, and it spoke to the fact that the last set of clusters that we saw on the island of Tobago came out of social family gatherings. And so as we approach the Christmas season, we know that Christmas is the time that persons use to spend with their loved ones and to spend with their families. We are asking that you use other means. Persons are very innovative. We are seeing virtual meetings. We are seeing virtual engagements. We are asking you, please, the cousins that want to come from Trinidad and so on, we are asking as best as possible that we limit those gatherings, because again, as Dr. Hoyt said, our last cluster came from family gatherings. Yes, and again, I am asking everyone to be safe as we continue, as we climax actually 2020, because we want to see you all in 2021.
All right, thank you very much, Secretary. I really do not have much more to add to that. Just remember, as we enter this Christmas season, we really want to limit the gatherings, and we really want everyone to be safe. Wear your masks, avoid any charges, any fines that may be incurred by that, and let us all just have a really enjoyable and safe Christmas season. Season's greetings to all those who are viewing, and once again, have a wonderful afternoon. Thank you.